Hi, I'm Dr. Shea Stark with Pro Chiropractic, and today I'll be demonstrating a soft tissue technique called pulse wave therapy for carpal tunnel syndrome and wrist pain. A lot of people don't realize that chiropractors can treat carpal tunnel syndrome, but it is something that we deal with because it involves impingement of the median nerve in the wrist that can cause numbness, pain, and tingling into the hand. Now, one thing about carpal tunnel that people tend to get misunderstood is that carpal tunnel is not the entire hand or pain in the entire hand. It's actually focused on the thumb, first finger, and middle finger. And so if you have any symptoms like pain, numbness, or tingling in the ring or pinky finger, then it is not considered carpal tunnel. That is a different impingement of a nerve. So with carpal tunnel, what we're really going to focus on is right in the wrist, just below the thumb, okay? And so what we're going to do here with Jane is work on her carpal tunnel using the pulse wave therapy. And what we're doing here is creating sound waves that help to penetrate the soft tissues and break up any of the adhesions in that area. So how we use the pulse wave here is we're going to apply some ultrasound gel and just a little bit here. And then we're basically going to work within this small area here where the carpal tunnel actually lies and the impingement of the median nerve can take place. Okay, so we're just going to spread the gel around here a little bit. And one of the things that's important to remember with using this therapy is you want to make sure that you keep contact with the skin as much as possible while using it. So this is going to make a clicking noise during the treatment. Is that pressure okay? Is it too much? Okay, try to relax that hand. Good. Okay. And so here we want to move very slowly through the treatment area to affect the tissues involved. You want to make sure while doing pulse wave that you don't stay in one area for too long, as it can start to cause slight damage to the tissue. So we move around very slowly to get the entire treatment area. And so again, we're just going through the carpal tunnel in the wrist, going over that flexor retinaculum, and then up into the wrist a little bit, just to try to get all of the areas that could be involved in her pain. Okay, all right. So again, pulse wave therapy is a great treatment for carpal tunnel syndrome, as well as manual adjustments to the wrist. If you have any other questions about pulse wave or carpal tunnel syndrome, please visit our website at www.prochiromt.com. And again, I'm Dr. Shea Stark. Thanks for watching.